I am an education and behavioral health consultant. What does that mean? One of the things that I do, and one of the main things that I have been doing for the last 4 years now, is advocacy work. And what advocacy work consists of is parents kind of seeing, knowing, feeling that something is going on with their child when it comes to both systems, the education system as well as the behavioral health system. And sometimes the two intertwine. So as a parent, if you feel like stuff is going on with your child, you feel like you're not being heard, you feel like you're not getting through, they haven't been tested, you think they might need extra support, you requested testing and you didn't get it, they have an IEP but you don't feel like it's being implemented, all those different things fall in the realm of the advocacy part of the educational consultancy. Then what I do is I often attend those meetings with parents. So I can go to the IEP meeting with you. I can go when they talk to you about the evaluation report. Because when they do a lot of this, the testing, the IEP, a lot of the language, it can be very confusing and it can be very overwhelming. So a lot of the IEPs can be up to 25 pages long. The evaluations have these, specific terms and ratios and just a lot that if that's not your field, if that's not your profession, you won't necessarily be able to follow as a parent. And quite frankly, what should happen is that it should be explained as you go along. And a lot of time that doesn't happen. And then parents come to me and they're saying, that they feel stupid, or I can't believe I didn't know this, or I didn't know what questions to ask. Just like whatever it is that your profession is and what you do, other people, you would be able to speak in your language and the terminology that you use for your work, and none of us would understand. It's not meant for you to have all this information. It's not meant for you to necessarily know all the laws and information. But when you have a child that is participating in one of these systems, it is good to have that information. And then it is good to have somebody there with you who is listening and asking the questions, and then afterward able to articulate it to you in a way that you can understand it, in a way that you know what questions you want to ask, and you know how to articulate what you feel your child needs. So as an advocate, as an educational consultant, as a behavioral health support person, I'm able to say, I've seen this here, I've seen that there, that doesn't really work. I have seen that work. And I can also say, based on the information that we have on your child and from the experiences and my knowledge base, that this might work better for your child. This might not work so much. So again, even for the behavioral piece and how things are implemented and recorded in the IEP, our teachers are not trained in behavioral health. That's just the facts. It's not that they don't want to help children. It's not that they don't want to make sure that all these different behaviors aren't going on, that the behaviors aren't affecting the child's education. They don't have the information. And so again, for me, it is me bringing that to the table. I have 15 years of experience in the behavioral health field. So I'm able to use both my degrees and my experience and knowledge base to basically make recommendations. So if a child is one of the bigger ones right now, I'll give you guys an example, is that a lot of children, whether you feel like the diagnosis is overused, or if some kids just have a hard time paying attention, or if they have the diagnosis of ADHD. The bottom line is that the distractions occur. The ability to sit down for long periods of time is a problem. And again, it's a problem for adults. So I don't know why we don't think it would be a problem for children. So my biggest recommendation is that there needs to be built in breaks for these children. You know that they can't sit there for 2 hours at a time, an hour and a half at a time. Okay. If you're having instruction time and then you have, work alone time, and then you have, let's go over the answers. Once you do the instruction, have it built in where the child takes a break. Have it built in that once they take a break, take a walk, whatever, they come back, you do another 20 minutes of work. You go take another 2 minutes. The goal is to make sure that things are in place to prevent the behaviors from happening in the first place. So that's basically what I bring to the table. I bring my different experiences and knowledge and skill, quite frankly, because, the trainings and things like that I have participated in over the years, I bring that to the table as an education and behavioral health consultant. So I think I might have touched on the basics of what I do and how I do it. But again, if you have any questions, please feel free to call me. You can reach me at 267-902-5045, or you can email me, Naomi@advocacyunlimited.net. Okay. And of course, you can find me on social media. So if you need to DM me or message me on Facebook, that's fine. I'm in different Facebook groups. If I see that there's a concern that a parent has, I have told them, give me a quick call. I'll set you up with something, just give you a few pointers if that's all you need. I do free consultations right now. It's going to be 15 minutes. And believe me, the consultation that I did yesterday was under 10 minutes, and she had 5 bullet points to walk away with. So I can give you information, and I will give you information, because the overall goal is to support. However, I do also provide services at a fee. So if you feel like you really, really need somebody there with you at the table and to support you, I can do that as well. I have packages and payment plans. So don't feel like you can't afford to help your child. You don't have the money, you don't have the time, because now is the time, especially if your child is not in high school. Even if they are in high school, those first couple years, so much can be done before they graduate. So never feel like it's too late. Never feel like, they're so far gone, there's nothing that can be done. There's always something that can be done. And like I said, we can set up a payment plan. There's different things that I can do to make sure that you, at the very, very, very least, have basic information and have somewhat of an educational plan to get you started. Okay? So I'll talk to you guys